welcome. Fijians all around the country celebrated the 2018 World AIDS Day yesterday, the 1st of December. A day that presents the opportunity for people worldwide to unite in the fight against HIV and to show support for people living with the virus. Let's welcome our guest, Dr. Dashika Balak, Senior Medical Officer at the Suva Reproductive Health Clinic. Thank you so much for joining us.
Thank you.
Tell us about what's happened this week and the celebrations that you had yesterday.
Well, this week has been very busy for us. We've been preparing for this for a long time, and this year was our national World AIDS Day celebration, which marked 30th anniversary of the first advocacy and awareness that started. First case of HIV was diagnosed in 1989, but then advocacy had already started in 1988, so therefore the 30th year of anniversary this year. This week we started off on Monday with the Fiji Network Plus, the positive community, who had a road show. So they did a road show in conjunction with some churches, mostly in the Western Division, where they have recognized some communities that needed advocacy and awareness programs and also testing. So there was a whole group of positive people together with some of the healthcare staff and NGOs and CSOs who boarded a bus and took a tour for the whole week. And then come down to a couple of weekdays later, we had some screening and awareness programs in Mindpearl, so as part of our conjunction with employment sector. And then towards Friday and Saturday, we started planning for the big event that is World AIDS Day on Saturday. So Saturday morning started off with a march, and then we had formalities together with a concert at the Sukuna Park.
So let's go into the purposes behind the week-long celebrations. You know, you have different forms of advocacy and support, but what is something that the ministry would have liked to get out of this week's, or rather this year's celebration?
So our major point of doing this celebration this year was to mark the theme. So the theme for this year is Know Your HIV Status. And so there is a big drive for testing this year. As we know that we are doing testing, but we are not reaching out to all the people that we want to. So this year our major theme is that we need to get people tested so that they are aware of their status, and if depending on what their status is, they're linked to those services.
There are many factors that come to why people don't go out and get tested, even though it's a very important issue, not necessarily because you may have HIV/AIDS, but just to be sure where you stand, of course, going with the theme. But let's just have a quick look at the numbers, looking at statistics over the few years. What's it been like? Has there been an increase in the number of cases that have been recorded across divisions, and just the whole breakdown of that?
Okay. So yes, our statistics has increased over the past 3 years, we would say. The cumulative number of cases since the first diagnosis in 1989 till July of this year is 919 cases. In the past 3 years, so that is from 2015, there has been more than 80 cases recorded annually. And
more than 80 cases just within a 3-year period?
Yes. And so this year, just till July, we have 65 cases recorded already. So just half of the year and 65 cases. So we are presuming that this year we may have more than 100 cases recorded.
In the breakdown of those numbers, are there more males or females that have been infected with this?
So the disease is fairly well distributed among all the genders. So male and female almost same. Say about 49% each, and then that 1 or 2% is made up of transgenders, mostly, whom we capture as the third gender in our reporting purposes.
So the whole way of thinking that used to be before, that was only being transmitted within the LGBTQ community, that has that's prevailed so far, or has that changed as well?
So far in Fiji, our numbers have been well established in the general population, so that is the heterosexual population. Over 80% of the disease is among the heterosexual. But saying that, our numbers in the LGBT community, mostly the men who have sex with men and transgender people, has increased. And I think this is due to more testing amongst those groups.
So the numbers this year, you said by July you had 65. Does that worry the ministry?
Not really. This is something that we had projected, and we expected this a long time ago. And so therefore, what we have recognized is because we have not tested the whole population, or at least the 90% that is the goal of UNAIDS. Therefore, we don't really know our prevalence of the country, or what is the actual burden of the disease in the country.
What about by age group wise? Which age group tends to have people with HIV?
This is no doubt amongst the youths between 20 to 39 years of age. So if you look at the numbers, it's about 70 to 80% who are infected among that age group.
Mm-hmm. And what about in putting it into perspective in the Pacific region? Does it seem like Fiji has higher numbers compared to our Pacific neighbors?
Yes, definitely. Yes, our numbers are way higher than the other cases in the Pacific. Most of the Pacific Island countries, they may have less than 50 cases, but some may not even have any cases.
Well, why do you think that is?
Well, there could be a lot of reasons, but I think one of the reasons is, again, they have not tested their whole population, so they don't really know the burden of the disease.
Mm-hmm.
So for the number of people that are known to have been infected within a year, how is the Pacific in general doing compared to the rest of the world?
Pacific is still increasing in the number of new cases. Rest of the world, most of the developed countries, their number of new cases are decreasing now, but for the Pacific, we are still increasing. So our incidence rate is still increasing. Mm-hmm. Yes.
Well, what about the number of screenings and testings that you have had in the past few years? Has there been an increase in the number of screenings that have been done?
So I would say that our number of screening may have increased a little bit, but not as much as we expected. But yes, our screening services has rolled out or has been decentralized to other subdivisions, and that is due to availability of testing in the labs in those subdivisions.
So you've been working with reproductive health in the Ministry of Health for a long time, and I'm guessing you've had more than one celebration. So over the years, what, in your experience, how has the trend developed in terms of understanding HIV and all of the myths around it?
Okay, so when I first joined this field, that was in 2013, there was a lot of stigma, not just from communities, but a lot of stigma from healthcare workers themselves, and that was one of the biggest barrier of accessing services. But come down to now, after 5-6 years now, I have noticed a lot of change, especially in stigma. Healthcare workers are well versed now. Stigma has reduced a lot. Even in communities, it has reduced a lot as well. Health-seeking behavior or accessing testing services by people has also increased, but then it's usually the same people who access the services.
We should probably explore that more, but...
We'll have more for you right after the break. Welcome back. Dr. Balak, we were talking about statistics related to infection, and the numbers, as you said, are growing in Fiji. But what about the number of people that generally go to STI clinics to get screened? Is there complacency that you've seen in the ministry?
So in Fiji, we have 3 specialized STI clinics, or known as the reproductive health clinics. But then over the past years, since 2015 actually, we had rolled out testing services in the subdivision. So now we see that there are more people accessing these services in the other health facilities as well, and we have been advocating that these services are not just strictly offered in the STI clinics, but also in all the other health facilities, which should be free of charge. So in the STI clinics, we mostly see the same people coming. There may be a few new ones coming who just walk in and ask for a HIV test, but it's usually the same ones who know, what services are provided in the clinic.
Mm-hmm.
And for someone who's never been screened before, someone who doesn't know the process, when you walk into an STI clinic, how are you tested?
So our clinic is just basically an outpatient walk-in clinic. So they are greeted at the reception, and they're asked if they're new or old patient, and then depending on that, then if they're STI cases, then because all the nurses are allowed to see STI cases, then they are seen by my nurses. But if they're already known HIV cases, then they come directly to the doctors and be seen by the doctors.
Given that something like this in the Pacific, it's still considered a taboo subject. People don't like to talk about it, and they don't like to be seen at clinics or going for testing and all of that. That could be one of the factors why they don't, show up for testing. For those that do go, they may be concerned about confidentiality, like are their details being protected? Say, for example, if they were to be tested and the results come back positive, does that happen?
Well, yes, before it was happening, but now I can assure you that there are more and more people who are accessing services and they just walk in freely. So they're not afraid to walk into a STI clinic. And I think one of the biggest factor in that is that we have moved away from that name STI or HIV clinic, and we have integrated other sexual and reproductive health services into our clinic. So we not strictly look after STI and HIV, but we do a lot of other services such as family planning, cervical screening, men's and women's health. So there are a whole lot of things that are being done. So patients just walk in freely.
This year's celebration theme was Know Your HIV Status. And within the celebration, what are some ways in which you encouraged more people to screen?
So I think this year's celebration was more focused on youths. So we had a big concert this year. We launched what we call a Test 4K Fiji concert. So this Test 4K Fiji is actually aiming at testing 4,000 youths till June of next year. That is the World Testing Day. So we had concerts where we had youth groups, youth bands and youth dancing groups who came in. So they attracted a lot of youths to come in. And we also had in between the sessions, we had lots of messages going out and asking people to come and get tested.
And are you involving different stakeholders in this? There are NGOs and of course faith-based organizations in Fiji.
Yes. So HIV program is never done in silo. It needs integration. It needs partnership with other government and non-government organizations, civil societies, our UN agencies, WHO, SPC, UNICEF, UNAIDS, UNFPA, and also it needs partnership of faith-based organizations, youth groups, leaders, and communities at large.
It's quite interesting to note also, most people don't know that the World AIDS Day actually falls within the 16 days of activism.
Yes, it does. Yes.
Have you been working with the FWRM on this as well?
Not really. They have their own program, but for us, I think World AIDS Day also marks women's health as well, women's health and their child's health, because we have a PPTCT program. So that is known as the Prevention to Parent to Child Transmission of HIV. So this is mostly done in antenatal clinics for pregnant mothers. So this is where we come in as part of the 16 days of activity.
On that PPTC note, we would like to get into that a little bit. A lot of people have this idea that because, say for example, I as a woman or anyone who's a woman has HIV and they expect, right, they're pregnant, the rate at which HIV can be transmitted to their children, is that a big factor?
There is a lot of factors which should be considered in regards to transmission, but yes, if a mom has been diagnosed with HIV and she's an early booker or has come in quite early in her pregnancy and she has found to be HIV positive, we enroll her into this PPTCT program, which just basically means that she needs to be started on treatment as soon as possible. And so the success in Fiji is that if that happens, the babies are born free of HIV. So the only transmission we see to the babies are mostly through unbooked or late booked mothers, where viral suppression hasn't happened to that extent.
Let's take a look quickly at the number of cases that are being recorded. Is it more prevalent in the urban centers or in the rural sectors?
Well, actually, it's quite generalized. It's quite widespread, yes. And because of the movement of our people, you know, they usually stay in one place but walk in another place, and there's a lot of movement. So it's quite widespread, I would say.
Are there any new lifestyle indicators across the board?
Basically, I think the indicators are same as before. It's just that these indicators have increased now. And so we know that the major mode of transmission for HIV is sexual intercourse, unprotected sexual intercourse. And nowadays we know that sexual intercourse has really increased, especially among our young people. And plus, it's not just with one partner, but they have multiple partners.
Actually, on that note, it has increased quite dramatically. Not necessarily the number of cases being transmitted, but for lack of a better term, sexual promiscuity or sexual liberation by most people nowadays. You happen to have apps, you have dating sites. There's
right,
no
I mean,
more.
Monogamy seems to be an outgoing trend.
Yes.
Yes.
And because of that, it's more easier to access sex now than it was before. Before, it was a bit of a taboo subject. You wouldn't go out and have multiple partners. Men and women both across the board are doing that. Do you think this is also a risk factor?
Yes, it is a risk factor. So for us in the field of HIV, especially any young person within that age group of 20 to 39, and if they're sexually active, that itself is a risk factor to HIV.
And what about other detections that can be done? For example, women need to go for pap smear tests. I think off camera we were just talking about this, how women these days don't seem to be going for their screenings for their pap smear tests. And you had mentioned that the rate at which these tests are being done has pretty much stagnated over the years.
Yes, I believe it is because our health-seeking behavior has changed a lot as well, and most of us, when we are not in any pain or we don't really seem to be deteriorating in health, we don't really seek health services. And with women's health, with pap smears, and even with breast cancer screening as well, they won't go to any health facility unless until they don't have any signs and symptoms.
Yes. Speaking of signs and symptoms, say for example someone were to contract HIV, how would they have any indication that they may have that without testing being done?
Okay, so basically what happens with HIV is that a person can live with this disease for at least 10 to 15 years maximum without any signs and symptoms showing. So usually the signs and symptoms are normal symptoms that we can get like any other infections, but the thing will be the frequency of these infections will be much more higher or much more faster compared to someone who has an intact immune system. Mm-hmm. So the whole signs and symptoms of HIV is dependent on the person's immune system. If your immune system has really depleted, then you are going to get sick more quickly. And so when I say you're going to get sick, it's normal sicknesses that you are going to get, but more quickly.
Mm-hmm.
We'll have more for you right after the break. Welcome back. Dr. Balak, in your capacity as a senior medical officer, talk to us about the accessibility of STI clinics around Fiji.
So in Fiji we have 3 clinics, as I have mentioned. So one is in Suva, that's at Rodwell Road where the old government pharmacy was. One is in Lautoka, that's opposite Lautoka Hotel in Noviti Street, and one is in Lambasa, that's in the main town. So accessibility, these clinics are open Monday to Friday, normal 8 to 4, but accessibility shouldn't be a problem because it's just a walk-in clinic. But yes, I do know that there are people who live quite far away and they're unable to access services in this clinic, saying that these services are also provided by other health facilities, so they can access these services any health facility near to them.
Mm-hmm. So there are no general complaints of people not having access to screening facilities in Fiji?
No, there shouldn't be.
What about treatment? Let's look at treatment that is prescribed to those with HIV. But before we get to that, just a quick little note. Most people seem to group HIV and AIDS in the same lump. If there's a bit of a difference between them, one leads to the other. It's not the moment you have one, you're definitely going to get the other.
Definitely, yes. So HIV is just a virus itself, and AIDS is the last stage of HIV. HIV has 4 stages, and AIDS is the last stage where your immune system is almost shutting off, and you have all these infections and diseases settling in your body that will ultimately lead to death. I mean, this is without any intervention. If you have HIV, it's not necessarily that you will have AIDS, but yes, definitely if you have AIDS, that means you have HIV because it's caused by that virus.
So if you have early screenings and detection is done, you go through treatment, there's a possibility that your quality of life can be sustained at the level that it is now. It won't deteriorate further, and the earlier that you get this detected, of course, the longer you may have with your friends and family and enjoy life.
Yes, definitely, and that is the aim of treatment. So now treatment is also part of prevention itself, so what we call as treatment as prevention. So what it basically means is that the early you are diagnosed, the early you are put on treatment, your survival is prolonged.
Right. So you mentioned 4 stages, AIDS being the last one. Is there any indication that if you get tested and that you get diagnosed with maybe stage 1, stage 2, or stage 3, which is more...
At which stage is intervention too late?
Oh, actually, it's
for
not.
AIDS can...
It's not. Even if you are in the 8th stage or last stage, we start you on treatment, it can be reversed.
Okay. So looking at treatment and looking at medication, what do you prescribe to someone who has this disease?
So for HIV, there are specific medications that are known as antiretroviral drugs. So these antiretroviral drugs are basically at this moment provided by the 3 reproductive health clinics in Fiji, which are free of charge. And so patients just have to come in, walk in, and get their replenishment at least every 3 to 4 months, depending how well they're doing.
For free?
Yes, it's free of charge in Fiji for all its patients.
And how often do they need to take these medications?
So this is a lifelong medication which they need to take daily.
And in terms of the quality of life, in comparison with someone who is taking the medication and who isn't, as opposed to someone who is completely HIV free?
Okay. So the quality of life, or definitely if you are HIV positive and you are not taking your medications, you will definitely end up in the 8th stage and ultimately which is fatal death. But if you are HIV positive and you are taking your medications, you lead a normal life. So normal life saying that your life expectancy doesn't change. So again, your normal life is just like an HIV negative person.
We also happen to have instances, because we live in the Pacific, a lot of people always have, those bush doctor remedies. Say, for example, if you have a cough, they'll give you something from some root or some leaves. Have you ever come across cases where, communities or elders or maybe just people, family and friends, will prescribe these alternative medications, home remedies for this?
Yes, in Fiji we know we have a lot of herbal doctors, so there's a lot of talk about herbal medications that goes around. And there was a period when there was a herbal medication that was provided for the cure of HIV. And
Right.
so during that period, a lot of our patients did switch. They stopped taking the antiretrovirals.
The
Oh, what
noni,
happened?
was it the noni juice from New Zealand that apparently cured cancer as well? Among its cures was diabetes, cancer, HIV and all of that.
Yeah.
There was a huge buzz around it. I think it was in 2006 or 7.
Yes, in the early 2000s.
Anything since then?
Since then, not really. Oh, the miracle water.
Miracle water.
Yes, yes.
Please tell us more about that.
Yeah. So there was a big buzz about the miracle water, but then the thing was that most of the patients, they didn't stop taking the medication, but then they still went for the miracle water. So that was a good thing. So we didn't lose any patients due to that.
I suppose we should not judge anyone for having any faith in the supernatural, or maybe in a higher power that may help them. But for those who switch to alternative medication and they don't continue with the medication that is being provided by the Ministry of Health, what happens to them? Is there any data, any statistics, any cases where they improved?
For HIV, no. So what happens is when our patients come in and they enroll into our care, we do a rigorous counseling, and we always tell them that we are not saying no to traditional medication or herbal medication. It can be taken in conjunction with your medication. It's just that they need to maybe change the timing, if they're taking their medication at night, so maybe take the herbal medication in the morning. So we always say that we are not saying no to your beliefs, but as long as you also take our medications, and we've seen that works.
So besides the actual medication, talk to us about the support systems that you have for someone who may be traumatized by the whole experience.
Okay. So for our patients, if they are really traumatized, so there are various ways they can be traumatized. And one of the major ones is stigma and discrimination, and also non-acceptance of the disease. So we have counseling services provided for them. So I, as a doctor, I do a lot of counseling for my patients, and this counseling is done at every visit they come to the clinic. Apart from that, if I'm not able to provide those counseling that they really need, then we have Empower Pacific, who is also a counseling provider, so we refer them to Empower Pacific for further counseling.
Do you happen to know of any support networks, not necessarily with any NGO, maybe community-based, that people can go to? Because it may be a bit of a hassle for someone who is not living in areas closer to these counseling centers, for them to actually make the trip and go there. Just considering the fact that they're living with something like this, they may feel like, first of all, they're disenfranchised and they don't want to go out and make all that effort. So just having something within the communities, people that they can talk to, peers, religious, faith-based organization
Perhaps the
leaders.
military can, not the military, the ministry can facilitate a space where families can come together
So we have an organization known as Fiji Network of Positive People, and so this is made up of HIV positive people, membership based. So they mobilize and they reach out to communities, and they go out into communities and they talk to the patients as well, and community members as well.
So generally those who are adults, they would obviously have friends and peers that they would talk to. Disseminating information and awareness on this would be easier. But what about those who are younger, especially now that you notice the number of teenage pregnancies are going up, sexual promiscuity within those who are minors has also increased. How do you go about trying to educate them and making them aware of the risks of unprotected sex?
So we have a lot of assistance from youth groups and community-based youth groups majorly, and also faith-based organizations. So these are the ones who take the lead role in advocating amongst these groups.
We'll talk more about education and advocacy, but right after a break. Welcome back. Dr. Balak, let's talk about education, especially for those children in high school. When I was in high school, a large part of family life education and sex education involved the implementation of abstinence. Now we know that, I mean, in the 21st century, it's not a very realistic approach, is it?
No, not really. Well, we were advocating about the ABCs, abstinence, be faithful, and condomize. But now we see that the A and the B actually don't work. Yes.
So what's left is just option C.
Yes.
Right. But then for that, you'd have to go out and make sure that you show these children. I mean, of course, you can talk about it in theory as much as you want, saying this is a tool which you can use to make sure that you don't transmit any STIs, you don't get pregnant, any of those. But unless you have some sort of a demonstration actually showing them, because of course even a condom it's susceptible to breakage, and anything could happen. I mean, if you're a teenager, whether you're a girl or a guy, whoever's going to be using it, if you don't know how to use it, you could cause a break or a tear or something, and it's not going to help.
So does the ministry, and specifically your department, work with the Ministry of Education?
So in Ministry of Education, we have a family life education program that has that includes syllables or modules on STIs, HIV, and sexual and reproductive health. Unfortunately, we as service providers, we cannot go and do a condom demonstration. This is something in talks, and hopefully in the future we will be able to do so. But then we do know that this family life education has evolved, over the years. As you've said, Zia, during my days in school, we didn't talk about sex at all. But now at least our children are talking about it, and they do know that there is something known as condom that can protect them.
And there's also, it's very common to see a lack of sexual reproductive knowledge for the opposite sex. For example, if you're a male and you're engaging in sexual relations with a female, it's important to know about the sexual reproductive health of the other person as well. And in a lot of schools, when these discussions are being held, boys and girls are separated, aren't they?
Yes, they are. Yes. Well, I think that has also to do with children are shy, especially if they're grouped with the opposite sex. They usually cannot ask those questions that they may just ask when they're within their own group. So I think that is one of the reasons why they have separated the groups. But then I think if they are doing that, ultimately after they have given the knowledge to each groups individually, then they need to be coupled together to provide further.
So essentially a segregative approach is not going to work in the long term.
No.
Okay. But what about the Ministry of Health? Do they allow for the Ministry of Health to go around and conduct maybe screenings or testings for children, maybe even for those who are of legal age? Because you have children who are going to Form 6 and Form 7 who are already 18 years and above.
So for schools, when we go to schools, we can only do advocacy and awareness program, but not testing and screening on site. But then schools do, during their breaks, they do have like youth groups or camps or church groups and stuff. So that's when they ask us to come and do testing.
Let's look a little bit on the darker side of things. Looking at the mortality rate over the past years for those who have had HIV or AIDS, what's it been like?
Mortality rate has decreased significantly, even though the number of HIV has increased. But then the ones who are on treatment, I would say that mortality and morbidity both has decreased significantly.
There's still stigma that's related to that. Those who happen to have that, most are shunned by their family, their friends, their co-workers, communities, just as a whole. And if they're unable to look after themselves, say for example their health deteriorates to a point where they need someone else to look after them, are there any hospice services, anything that's available to them?
So hospice services, we have hospice services, or we have what you say zone nurses who look after their patients in their own zones. So in this era of antiretrovirals where we have treatment, we are not expecting our patients to die of HIV. They may die of other complications like non-communicable diseases or even road accidents. So if they have those infections or diseases, then you have appropriate services provided to them even at home.
So Ziad, we've noticed over the past few years that when you happen to have people who are prominent figures in society and in the community, if they stand up and talk about this, it creates more awareness. Just to highlight, yesterday of course was World AIDS Day, and one of my favorite icons, lead singer for Queen, Freddie Mercury, he passed away from complications he had from AIDS. There was a biopic that was made recently about that. It got a lot of people talking about it again, and the timing couldn't have been better, especially when you have World AIDS Day celebration. Do you think that we need to have prominent figures in Fiji standing up talking about it, because it seems like a very hush-hush subject still? It's only the Ministry of Health that's talking about it, it's only the community groups and all of that, and there's not much being said by other people.
Yes, we definitely need figures to, prominent figures to stand up and step up and say that. I mean, we would like to, have a prominent figure come and step up and say, yes, I got tested today and I know my results and I'm safe, I'm fine. And so one of the biggest examples for us locally is our ex-president, His Excellency Ratu Epeli, who's still advocating. Whenever you see him, he carries a condom in his pocket. So he takes that opportunity to always talk to people and take out that condom and show them and tell them. So he's not just an advocate in Fiji, but the Pacific at large as well.
Before we round off the segment, we're going to go on a tangent for a while. A lot of people, perhaps in Fiji, are aware of the recent case of genetic engineering in China, where a scientist used a gene editing tool to reproduce the world's first HIV immune babies. What are your thoughts on that? Well, of course, there's a huge outcry from the scientific community about the ethics of it.
Yes.
But if we were able to edit out HIV susceptibility from our genes, wouldn't that be a good thing?
Oh, well, let us put it this way, Ziad. So if we are genetically editing babies, obviously that is unethical. But then, certain countries, they have their own ethics board through which they need to, let all these processes go through. So if in China this was ethically approved, so maybe it is ethical for China, but it may not be ethical for other countries because the ethics board won't approve of it. But then again, on the other side, how sure are we that this is going to work? Because we've seen there have been previous successes in the HIV era, but then it has, gone back and reversed. Or they may have been able to model this among some people, but then if they try and model this among the other cohorts, it doesn't work. So only time can tell us.
We'll have more for you right after the break.
Back. Dr. Balak, we were talking about HIV strains just before the break, and you just mentioned off camera about how you have two different strains, which is something that even we didn't know about.
Yes. So basically HIV, there's two strains, HIV-1 and HIV-2, but the most prominent, 90% is HIV-1, which is worldwide, globally. HIV-2 is only amongst 10% of the population, and that is in the African country, restricted in that country, so we don't have it here.
Talk to us about the ability of the HIV virus to mutate.
Yes. So just like any other viruses, HIV virus can also mutate and also cause resistance to our patients. So that is why, again, it brings us back to early diagnosis and early treatment so that we can stop this mutation and resistance from happening. So there's two ways this resistance can set in someone's body. One is naturally, just like naturally mutation sets in so you can have resistance. But other one is if the patients are on medication and then they default their medications or they don't take their medications. So ultimately this will build up to resistance as well.
There's a general feeling of apathy amongst most people when you talk to them about HIV or AIDS, because they have this feeling that I don't have it, no one in my family has it, my partner's never had it, none of my partners in the past have had it. But there's always a probability that somewhere down the line, they may have been exposed to it.
Yes. That question has been asked to us a lot of times. Why me? Why I? You know, mostly if they are in a married couple and they've just had that one partner, you know, and then they will be like, why me? I just had one partner, and why did I get the disease? But remember, your partner has a past as well. So everyone has a past, and it's not known unless and until you get tested. So you cannot say that I don't have a risky behavior, I can't get HIV, because it depends on a lot of factors. And it also depends on the factors of your partner and their partners as well.
Mm-hmm. And just to, of course, push this point forward, it's transmitted through sexual activity, not necessarily just through one particular course of sexual activity, correct?
Yes. So majority of the transmission is through unprotected sexual intercourse. So unprotected, regardless of which type of sexual activity you are having. But yes, of course, anal sex carries a higher risk of transmission compared to vaginal and oral sex. Mm-hmm. So that is why we say men who have sex with men are at higher risk of having HIV compared to the general population. But then now we know that females also have anal sex, mm-hmm. so they are at risk of getting HIV as well. Mm-hmm. But apart from sexual intercourse, we have other modes of transmission of HIV. So now, as we have drugs coming into our country, mm-hmm. and so we have crystal meth in the country, and if people are injecting that crystal meth, they're using or sharing needles, so that also poses a risk of transmission of HIV as well. Mm-hmm.
So for the Ministry of Health and the Reproductive Health Clinic, what is the future of advocacy? Are there any plans that the ministry has in the future?
So I think our bigger picture in the future is that we need to get most of our people tested. So our screening has to be, you know, at large. So this depends on different subdivisions and health facilities. So every year or from World AIDS Day, they have their own celebrations and their own little programs that goes around. So what we do is just we help them in whatever way they need us to assist them. Mm-hmm. But I would think that for Fiji, we are moving towards the 90-90-90 target that is by UNAIDS. Mm-hmm. So what the first 90 means that we need to know 90% of our population needs to get tested.
Before we round things up, is there any possibility of the Ministry of Health partnering with the private sector, just like the Cancer Society has, to raise awareness on this, maybe to get testing or advocacy done in certain sectors of the private sector, say for example with some of the banking businesses, some of those who have those nightclubs and all of that, just to create more awareness on the importance of getting screened and getting tested?
We are already doing that. We have a lot of partnership with private sectors, and especially with the banks and nightclubs, as you have said, with big, large employment sectors. So yes, that is something that is ongoing. Mm-hmm.
Last question. What would you say, what message do you have for someone who has had unprotected sex in the past few months or years?
I suppose
they've never gotten screened.
I suppose
like
anyone who's ever had
right.
any form of unprotected sex would need to get tested.
Right. What message do you have for them?
My simple message will be that, you know, if you are lax about it and if you think that you are not at risk of getting HIV, come on, the only way you will know is by getting yourself tested. So I would advocate for everyone to get themselves tested so that you know your status, because that's very important. As healthcare workers, we know then how to help you.
We wish you all the best in your future work. Thank you so much for joining us.
Thank you so much.
That's all we have for tonight. Join us again next week, Sunday. Have a good evening.